Did you know that some men ejaculate but do not see any sperm at all? They do not see any semen at all. This is called retrograde ejaculation. It is a lesser known and lesser talked about cause of male infertility. Hi, welcome to Health and Wellness with Dr. Happiness. I am Dr. Happiness, a trusted guide in family health and wellness. In today's video, I want to bring to you a lesser known and hidden cause of male infertility, retrograde ejaculation. I'll try to explain to you what it is, the symptoms, the causes, and the management. If that sounds like what you're interested in, then grab your seat and listen. What is retrograde ejaculation? Normally, during ejaculation, semen, which is the fluid part that contains prostatic fluid and sperm from the testes, is propelled out of the urethra through the penis and outside the body of the man. There is a small muscle at the neck of the bladder, urinary bladder, that prevents semen from going backwards instead of forward during ejaculation. This muscle, if it malfunctions, will cause semen to go backwards. And so during retrograde ejaculation, semen, instead of going out through the urethra of the penis outside, goes backwards into the urinary bladder. How does the person that has retrograde ejaculation know? The first symptom is that after ejaculation, the person doesn't see any semen at all. Some people call it dry orgasm. So if after ejaculation as a man, semen doesn't come out, and it's happening often and often, you have retrograde ejaculation. Also, the person will notice that soon after passing urine, after intercourse, the person goes to pass urine, the urine is cloudy or milky because the semen has mixed up with the urine. The man will also have issues with fertility because since semen doesn't come out, sperm doesn't come out, there'll be nothing to fertilize the eggs. So a man with retrograde ejaculation will suffer from male infertility. What are the causes of retrograde ejaculation? Retrograde ejaculation can be caused or result from poorly managed diabetes mellitus. It is a complication of improperly treated or improperly managed diabetes mellitus in men. What happens is that the autonomic nervous system of that area is affected. It's called diabetic autonomic neuropathy. This goes to affect the sphincter of the bladder neck and causes it to malfunction. Another cause could be spinal injury, like as a result of accident, the person injures the spinal cord in the area of the lumbar vertebra, the lower part of the back spine. If the spinal cord around that area of the waist is damaged, the spinal nerves will not be able to send signal to that bladder neck to contract and close during ejaculation. And so the bladder neck will malfunction. Another cause is surgery. If there's surgery of the prostate gland or the urinary bladder, maybe as a result of prostatic cancer or hypertrophy or bladder cancer, and those nerves, the spinal nerves around that area, are injured, they won't be able to send the required signal to the bladder neck because it's those nerves that supply the bladder neck and sends it information to contract when it should And so the bladder neck doesn't get this information. It cannot close when it's supposed to close. How does the doctor diagnose retrograde ejaculation? Normally, the man comes to the hospital and complains to the doctor. What the doctor does to confirm this is to ask the man to ejaculate and then pass urine, supply the urine after ejaculation. If the urine is examined, is cloudy, and sperm cells can be found in that urine, it is diagnostic of retrograde ejaculation. Luckily, the good news is that there's treatment for retrograde ejaculation. For those that have poorly managed diabetes mellitus, they should start managing their diabetes properly. And when it's properly managed, the functions will return to that bladder neck. For those with spinal injuries, there's really not much that can be done. But if they are desirous of fathering a child, there's something that can be done. The sperm cells can be collected from the urine in a specialized lab and used for IVF or IUI. Also, sperm cells can be collected directly from the testes in a procedure called ICSI, and that will be used to fertilize the woman's eggs during IVF or IUI. So there's hope. All hope is not lost. And now you have known it. This is a hidden cause of male infertility. Like this video, share it with people you think might benefit from it. Don't keep it to yourself, and subscribe to my channel so that you get informed, you get notified when I release videos that might uplift, update, and educate you in your health journey. I am Dr. Happiness, and together, let's build healthier and happier families.